When discussing causes of death, most people imagine common ones like heart disease, cancer, or accidents. But the world is also home to extremely rare, sometimes bizarre, causes of death. Today, we explore conditions so uncommon, you may never have heard of them. Stoneman syndrome, also called fibrodysplasia ossificans progressiva, is a disorder that gradually turns muscle and connective tissue into bone, effectively immobilizing the body. It affects roughly 1 in 2 million people, and is always fatal by around age 40. Harlequin ichthyosis is a severe genetic skin disorder where newborns are encased in thick armor-like scales. Until recently, survival beyond infancy was nearly impossible, but medical advances are slowly changing the outcome. Prion diseases, CJD and GSS. Some of the rarest and deadliest brain disorders come from prions, which are misfolded proteins that destroy brain tissue. Creutzfeldt-Jakob disease, or CJD, causes rapid dementia and death within months. Gerstmann-Sträussler Scheinker syndrome, or GSS, is even rarer, affecting maybe 1 to 10 per 100 million people, and progresses over years. Central hypoventilation syndrome, also known as Ondine's curse or sometimes referred to as congenital central hypoventilation syndrome, or CCHS, is a rare disorder that, causes respiratory failure during sleep, and sometimes even while a person is awake. Around the world there are only a few hundred cases known. Jervell and Lang-Nielsen syndrome, or JLNS, is a congenital genetic disorder that leads to both deafness and really severe heart arrhythmias. This condition puts kids at a high risk for sudden cardiac death, unless they're treated with pacemakers or medication. Sudden infant death with dysgenesis of the testes syndrome, or SIDET, is incredibly rare, with only about 22 cases ever documented. In this condition, a baby may die suddenly due to cardiorespiratory arrest, which is caused by problems with both brainstem and testicular development. Some autoimmune disorders, though rare, can be deadly if untreated, like giant cell myocarditis, anti-NMDA receptor encephalitis, and autoimmune vasculitis. Danon disease, a harrowing survival. So, a UK fitness fanatic named Victoria Thomas collapsed mid-workout and was clinically dead for 17 minutes. She survived and, doctors later discovered a rare heart-targeting genetic disorder called Danon disease, which meant she needed a life-saving transplant. Why knowing the rare matters. These cases may be rare, but they really highlight how fragile life can be, and the power of medical science to intervene. They also stretch our understanding of medicine, genetics, and mortality. If any of these stories surprised you, drop a comment below. Do you know any other rare or bizarre cases? And if you're fascinated by strange medical mysteries, don't forget to like, share, and subscribe to Social G for more fascinating deep dives.